Bismillahirrahmanirrahim. My affectionate students, Assalamu alaikum wa rahmatullah. Today I am going to discuss about aminoglycosides and tetracyclines. Aminoglycosides are a group of drugs that contain amino sugar along in their structure, and they have got glycosidic linkage. So, because of presence of amino sugar and linked by glycosidic bondage, they are known as aminoglycosides. And they are obtained from actinomycetes. They are the members of this group are streptomycin, gentamicin, tobramycin, amikacin, nitylmycin, paromycin, expectinomycin, neomycin, famicidine, capreomycin. These are the members of aminoglycosides. Now, the common properties of aminoglycosides. They have all the members of this group have got more or less common properties, and they have regarding pharmacokinetics more or less alike. That's why the common properties of aminoglycosides is very important. The properties are as follows. Number one is they all contain aminoglycosides. They are all contain like amino sugar linked by glycosidic bond. They are bactericidal. They act by inhibiting protein synthesis. They contain multiple positive charges in their structure. That is, they are polycationic drug. That means they are water soluble, lipid insoluble. So for systemic infection, this drug must be given by IM or IV route. It cannot be given by oral route for systemic purpose, but it can be given orally for gut sterilization. So these drugs are not absorbed, they cannot cross biological membrane. These drugs cannot cross blood-brain barrier. Even in meningitis, they cannot cross blood-brain barrier, and their distribution is mostly extracellular. These drugs are neither metabolized within the body nor excreted by tubular secretion. They are eliminated from the body by tubular glomerular filtration. This is the drug which is eliminated from the body by glomerular filtration. You please remember that most of a very important drug eliminated from the body by tubular filtration is penicillin, and by glomerular filtration is aminoglycosides. Now, microorganisms usually develop resistance against them. And they have got common toxic effects. They are auto or neurotoxic, myotoxic, and nephrotoxic. These are the common properties, and most of the drugs they have all members will follow these common properties. Now, antibacterial activity. These drugs are active against Staphylococcus and gram-negative organisms. Members of Enterobacteriaceae like E. coli, and then Proteus, Pseudomonas, Enterobacter, they are sensitive to these drugs. So members of Enterobacteriaceae are very sensitive to these drugs. Now the clinical uses of these drugs are gram-negative bacillary infection like septicemia, bacteremia, renal sepsis, abdominal sepsis, then pelvic sepsis. These are the drugs commonly used. And these drugs, the members of these drugs are used in case of community-acquired, hospital-acquired infection, or where there is more resistance case is more, or resistant organism is more. In that situation, these drugs are used in gas therapy, in first gas therapy, before having any culture and sensitivity report. And the members of this drug use this gentamicin used for this purpose, Also used tobramycin, a better sensitivity against pseudomonas. Also drug can be used is amikacin, nitromycin, used for this purpose. So if there is septicemia or bacteremia or pelvic abscess or renal abscess, abdominal abscess, this drug must be used, and along with may be used along with penicillin or cephalosporin or or aminoglycoside to broaden the spectrum coverage. Then this drug can be used in case of bacterial endocarditis, also used in case of tuberculosis, tularemia, brucellosis, plague. In tuberculosis, the members of this group used is tetracycline, and also used capreomycin. Capreomycin is one of the aminoglycoside which is selective for Mycobacterium tuberculosis. It is selective, though it is a drug of second line of choice, but it is selective for Mycobacterium tuberculosis. And streptomycin is a first line of drug for TB, and also it is used in case of resistant TB. Now this drug can be used, these groups can be used in case of UTI, then bacillary dysentery. These are the systemic uses of these drugs. This drug can also be used for local purpose, like infection of the eye, ear and skin. These drugs can be used. And here these drugs used, that is neomycin, femicetine can be used. And tobramycin also used in inhaler form in case of exacerbation or infective exacerbation of cystic fibrosis. Here tobramycin inhaler can be used. So these are this drug can be used locally, means to sterilize GIT, and previously used in case of bacillary dysentery. These drugs can be used for this purpose. Now, common toxic effects of these drugs. This drug will produce auto or 8th cranial nerve damage, then nephrotoxic effect and myotoxic effect. Now I am going to discuss one by one. If vestibulocochlear division is affected, vestibular division is affected, so there will be vertigo, there will be imbalance produced by these drugs, dizziness, vertigo, imbalance produced by these drugs. But usually this is reversible, and it also affects the cochlear division. This drug enters. This drug cannot enter biological membrane, but in middle ear, this drug is actively absorbed to that in the second in middle ear, and is deposited in the hair cells of the organ of Corti, and causes the degeneration of the hair cells of organ of Corti, leading to hard of hearing, ultimately deafness. So this it produces this type of adverse effects, and its adverse effects is more pronounced when there is use of along with if it is used along with loop diuretics or amphotericin B. This drug also, by decreasing the fluid of loop diuretics, by decreasing the body fluid, thereby decreases the endolymph concentration and causes further damaging effect on the hair cells of organ of Corti. Now this is the effect on 8th nerve. Now this drug also concentrated in the renal cortex, and also interfere the renal function, may cause interstitial nephritis. Now the next third toxic effect is myotoxic. We know muscular tone is skeletal muscular tone is maintained by the release of acetylcholine neurotransmitter from the cholinergic nerve at the neuromuscular junction, and thus it maintains the tone and contraction of the skeletal muscle. But when this drug is used, they will inhibit the release of acetylcholine from the vesicles. So in the synaptic plate, the amount of acetylcholine released will be decreased, and so it will produce muscular weakness, myasthenic effect. This drug cannot be given in case of myasthenic patient. It will, in this situation, it will cause further weakness, that is myasthenic crisis will be produced by this drug. So in this situation, this drug cannot be used. And so it has allergic action can also be produced by these drugs, like urticaria, rash, and sometimes hemolytic anemia, agranulocytosis. So these are the adverse effects. So in this chapter, most important component is the general features of this drug, general features of aminoglycosides. And this drug is not absorbed. Why not absorbed from the gut? Why it is given? Why is it given by injection route? The answer is the drug is a polycationic drug. It is water soluble drug, cannot be absorbed from the gut, so it cannot cross biological membrane. So it must be given by injection route, either IM or IV route. Another important point, there is a mechanism of action. Now I am repeating this thing. I missed previously. Now I am repeating these things, that this drug, pharmacokinetic, first thing I think, pharmacokinetic properties of the drugs. These drugs are not absorbed from the gut. Their distribution is mostly extracellular. They are neither metabolized inside the body nor excreted by tubular secretion. They excreted from the body by glomerular filtration. And this drug produces dose dependent, concentration dependent killing effect. And these drugs have got post antibiotic effect. Here the dose, it has got half-life about 5 hours, nearly 5 hours. But this drug, total daily dose may be calculated, and a single dose, total daily dose given in singly, so that it will achieve higher concentration and will produce prolonged antibacterial effect. And this is beneficial in compared to intermittent, that is twice or thrice a day injection schedule. Why this drug produces this beneficial effect? Because of its post-antibiotic activity. When this drug is given in total daily dose singly, then it has got binding pockets inside the body, and from that side it releases the drug, and that remains in above their MIC value and ultimately produce sustained effect. That's why it is practiced everywhere, total daily dose, because of its post-antibiotic effect and concentration dependent healing effect. And in this situation, toxic effects usually less than the individual therapy. So this point, these general features of aminoglycosides must be remembered, and its toxic effect is very important. Please remember the ototoxic effect, nephrotoxic effect, and myotoxic effect. So this is about aminoglycosides. Now I will discuss about tetracyclines. The tetracyclines, they are called so because they have got 4 cyclical ring fused together. Tetra means 4 and cyclines means cyclohexane ring. 6-membered cyclohexane ring fused together, and these rings are mostly unsaturated. So 6-membered 4 cyclohexane unsaturated ring fused together, and they form the tetracycline. These drugs are obtained from actinomycetes. Now, members of this tetracycline are oxytetracycline, chlortetracycline, limicycline, dimiclocycline, methacycline, rollicycline, doxycycline, minocycline. So these tetracyclines can be classified on the basis of their duration of action. It may be short acting, it may be intermediate acting, it may be long acting. Short acting tetracyclines are oxytetracycline, chlortetracycline. Intermediate acting are demiclocycline, methacycline, limicycline, Raleigh tetracycline. And the long acting are doxycycline and minocycline. Excuse me, one point was missing in aminoglycoside, that this drug, how do these drug aminoglycoside enter into the bacteria as they are water soluble? And the answer is, this drug enters into the bacteria before producing antibacterial activity, it must enter into the bacteria. But as it is water soluble, it cannot enter into the bacteria. But there is a special mechanism. Oxygen dependent active transport is involved for the entry of aminoglycosides into the bacteria. Once again, oxygen dependent active transport is involved for entry of aminoglycoside into the bacteria. That's why it is not effective against anaerobes. Against anaerobes it cannot work, because here there is absence of oxygen dependent active transport mechanism, and this transport mechanism operates in alkaline media. So alkaline media and oxygen dependent transport system is necessary for entry of aminoglycosides into the bacteria. Then it binds with the thious-ribosomal subunit and interferes growing peptide chain formation. There is peptide amino acid insertion occurs on the growing peptide chain, but that is aberrant or false amino acid, and this false amino acid is toxic to the bacterial membrane and causes leakage of the bacterial membrane and causes leakage of glucose, nutrients, glucose, amino acid, electrolytes, potassium. That's why it is called the lysis of the bacteria occurs. So those drugs act by inhibiting protein synthesis. They are bacteriostatic, but except is aminoglycoside, these drugs are bactericidal. Please remember, though it acts by inhibiting protein synthesis, but they are bactericidal. Please remember these points. Now I am coming to again tetracycline. Now the pharmacokinetics of tetracycline. These drugs are absorbed incompletely from the gut. These drugs are given orally, but incompletely absorbed from the gut, and food interferes its absorption. Food means milk or dairy products or milk containing products which contain calcium and phosphate. They will trap with the tetracycline. They will coalesce with tetracycline and causes adsorption and interferes its absorption from the gut. And also antacids, aluminum containing antacid, aluminum, calcium, magnesium or divalent cations will interfere its absorption. Because of same reason, they will chelate each other. Similarly, hematinics also adsorb this drug and interferes its absorption from the gut. But exception is two, that is doxycycline and minocycline. These two drugs almost completely absorb from the gut, and their food does not interfere their absorption. Now, if it is widely distributed throughout the body, it is not metabolized inside the body, and it is excreted by two means, one through kidney and one through hepatobiliary system. Most of the drugs excreted through kidney, but only two, that is long-acting tetracycline, that is doxy and minocycline, they are excreted through the hepatobiliary system. So if a patient needs tetracycline therapy, suffers from kidney disease, he or she must be treated doxycycline or minocycline. But if a patient needs tetracycline, but he is suffering or she is suffering from liver disease, then this patient, we use other members other than doxycycline and minocycline, because they will be eliminated through the kidney. So now mechanism of action, these drugs enter into the bacteria by simple diffusion as well as active transport, binds with 30S ribosomal subunit, interferes amino acid transfer array to bind with the ribosomal counterpart, thus inhibits growing peptide chain, and in this way it inhibits protein synthesis. And these drugs are bacteriostatic. And tetracycline is a true broad spectrum antibiotic. It's a true broad spectrum antibiotic because it is effective against not only gram-positive, also gram-negative, and then chlamydia, rickettsia, mycoplasma, protozoa, leptospira, multiple organisms are sensitive to this drug. That's why it is treated as termed as true broad spectrum antibiotics. Now, their uses, most broad gram-positive, gram-negative organisms, many anaerobes are sensitive to enterobacteriaceae. They are sensitive to this drug. Now, these drugs are used in case of chlamydial infection like trachoma, lymphogranula venereum, then psittacosis, pelvic inflammatory disease. They are used in case of rickettsial infection, that is Q fever and typhus fever. Also used in Borrelia infection, Lyme disease and relapsing disease. Also used in protozoal infestation like malaria, amoebiasis. In malaria, it is used in chloroquine-resistant malaria. It is used for treatment purpose. It is also used for prophylaxis purpose. Now, in amoebiasis, it is used in case of luminal amoebiasis or intestinal amoebiasis. Leptospirosis, it is also used in mycoplasmic pneumonia. It is also used in case of bacillary dysentery, cholera. This is a very suitable drug for adult to treat for the treatment of cholera. Vibrio cholerae is sensitive to this drug, and for adult treatment of cholera for adult we use this drug, and for infants we use macrolides. Now, this drug is also used in case of community acquired infection, hospital acquired infection, and then community acquired pneumonia, hospital acquired infection, nosocomial infection, and also soft skin and soft tissue infection. This drug is used. Also used in Mycobacterium murium, that is non-TB infection. Also used in case of acne, and also used in case of pulmonary peptic ulcer to eradicate Helicobacter pylori. Now, and this one of the member of this group is demiclocycline, which is used in case of syndrome of inappropriate ADH release. Here there is chronic hyponatremia, and cause is not known, but the demiclocycline will reduces the sensitivity of the ADH to the tubular cells, and how they will produce action by decreasing function or synthesis and function of cyclic AMP, and so the ADH sensitivity is reduced. Now, the adverse effects of these drugs. Most important adverse effects is superinfection. Superinfection is while treating primary infection with broad spectrum antibiotic, infection may or may not be cured, but a new infection will emerge up, and that new infection is called superinfection. And this is due to when broad spectrum antibiotic is used, it will kill the gut flora. So gut flora usually elaborates a protein, that is bacteriocin, which inhibits the virulent organism reside in the gut. So when broad spectrum antibiotic is used, they will kill the gut flora. So no release of bacteriocin, and so there is no suppression of the opportunist virulent organisms. So they will flare up and produce infection, that is known as superinfection. Also, it causes bones and teeth, affects bones and teeth. Bones and teeth because it contains calcium and phosphate more higher level, and this drug has got affinity for calcium and phosphate, so it has got selective affinity for the bones and teeth. So below 8 years of age, this drug will be, if given, it will be deposited at the growing in of the long bone and may cause dwarfism, and also deposition of the teeth causing discoloration, enamel dysplasia, malcast formation and pitting leading to caries teeth. And also it causes photosensitivity, and some of the members it increases intracranial pressure, and there may be, if it is used prolonged period, there will be nail stain, and sometimes minocycline especially will produce reversible vestibular disturbance which is reversible. Minocycline is used in case of meningococcal meningitis, both for treatment purpose as well as for prophylaxis purpose. And among this group, mostly widely used drug is doxycycline because of its long half-life and because of its single daily dose. It is given to initial dose is 200 milligram, followed by first day and followed by 100 milligram daily. So patient's compliance is better. So this is about it, and these drugs are contraindicated in case of pregnancy, in case of infancy, or pregnant and in pregnancy second trimester it will produce teratogenic effect, and in pregnancy it may adversely affect the kidney as well as liver. In liver there is fatty deposition during which is more in case of pregnancy, and if this drug is used, will further deposition occurs in liver, and that cause for liver that inhibits the liver function and also interferes kidney function. This drug and it is also given, not given in infancy, so pregnancy, infant, and like nursing mother, this drug should not be given to nursing mother because this drug crosses placental barrier, and teeth deposition, bones development occurs during, it starts from second trimester and it affects adversely the fetus. So these are all the points for tetracycline. So please thank you for your patient hearing. Assalamu alaikum wa rahmatullah.